Professor Batty, thank you again for sitting down with me.
Thank you for having me.
We're discussing the current Ebola outbreak that is growing in the headlines and growing around the world. So first off, how did this Ebola outbreak begin?
Well, there are a number of opinions in terms of how the outbreak began. The most popular one, I should say, is one that has been published in the New England Journal of Medicine, saying that there was a patient zero, a 2-year-old kid somewhere in Guinea, in the border regions of Guinea, who contracted the disease from eating something that came from the forest.
The virus is now spread across 5 African nations so far, with what's being called like the hot zone in Liberia. And there's been almost 7,500 cases, with nearly half of those people passing away from the disease. Why is West Africa struggling so much to contain the spread of this virus?
There are a number of factors that explain that. First, the healthcare systems in these 3 countries that are the epicenters of the disease were already vulnerable, because they had just emerged about a decade or less than a decade even from long years of civil wars. But also, in addition to that, is the fact that there was some mystery as to the source of this outbreak, and so most people did not believe that this was Ebola, because it had never occurred this far west in Africa.
Now, we're all being informed, especially in America, that this virus is now spreading beyond West Africa. There's been, there are people being treated here in America. There's been 1 confirmed case in Spain. Should the world as a whole be worried about a growing outbreak?
Yes and no. I say yes because we live in an interconnected world. No, because in other places such as America, for example, developed societies, they have much more efficient healthcare systems.
How should this outbreak further spotlight the need for improved healthcare in Africa?
If you look at the amount of money that has been spent since the civil wars ended in these regions, billions of dollars even on reforming infrastructures, rebuilding healthcare systems and so forth. Where has all that money gone? And those monies are taxpayer money from including America, European countries, and so forth. Given the amount of money that has been spent, those areas really should have had much better healthcare systems. But the money has pretty much gone down the drain. You can call it a huge sinkhole of corruption.
Why should students here care about Ebola?
Again, we're part of this global community of humanity, and so something happening in these areas of the world should concern us and touch us.
Any final thoughts?
Whenever you have the opportunity as a QU student, instead of trying to raise donations and everything, instead seek to advocate, seek to reform the policies.
Well, Professor Batty, as always, thank you very much.
Thank you very much for having me, Taylor. It's my pleasure.